It is Dental Health Month. Can't wait to talk to the kids today and tell them how to take care of their teeth. It's going to be a good day. I am ready. I am ready. Welcome, Bridge Road. I am glad to be back. Hello, Mrs. Bailey. Another productive year, I assume? Look at that nice sign. That's a good-looking sign. Hey, everybody in the office. It's a little slow today. Usually they come right out and get me. Well, maybe it's because of COVID. I don't know. Wait. I don't see anybody. Where is everyone? How am I supposed to do this if I can't get inside the building? All right, think, Dr. Baker, think. How am I supposed to get inside? How am I supposed to teach the kids about their teeth? Maybe if I go home, I'll be able to put something in the computer. All right, so now I'm home, and I gotta hurry up fast because these kids are expecting me to talk about their teeth. What can I do to get into the computer? Siri. Hey, Siri. How do I do It's Learning?
Okay, I found this on the web for how do I do It's Learning. Check it out.
I'm checking it out, Siri, but that doesn't look too easy. It'd be easier if you just put me in the computer. Hey, Siri, put me in the computer. Okay, here we go. Whoa, this feels weird. Well, I don't really think this is what I meant, Siri. Come on, this is the best you could do? Let's try it again. Hey, Siri, put me in the computer normal. All right, Siri, there's nothing normal about this. I look like a cartoon character now. One last try. Hey, Siri, why don't you try to put me in the computer so I look like I usually do? Well, at least I look normal. Hey, kids. Welcome to Dental Health Month. This is the weirdest year ever, as you can see, but I'm doing the best that I can. So, let's get started talking about taking care of your teeth. Let's go, Ridge Road. See what we can learn. So let's start talking about teeth. First, I want to show you some animals and their teeth. Take a look at Mr. Turtle here. He doesn't have many teeth like humans, does he? He's got just a couple up front, but he uses them exactly the same as you or I. He chooses food with them. Mr. Turtle has to defend himself from bigger animals, so he'll use them to bite something if it was attacking him, and he uses them to communicate. Now, to us, he looks like he's smiling, but he might be defending himself or maybe their babies from some other animal. Now let's look at little Mr. Monkey here. Does he look happy or sad? How can you tell? Well, just like humans, we look at their facial expressions and we look at their teeth to see if he looks like he's angry and he's showing his teeth and he's threatening to bite us, or if his mouth is really open like this, he looks happy. So we go from my little monkey to big Mr. Gorilla, and you definitely want to know if he's happy or sad. And if you look at him, he looks pretty happy. Actually, he looks pretty goofy. Dr. Baker loves gorillas. And lastly, I have my buddy the chimpanzee. And he's smiling, he looks happy, but his fingers are in his ears. If his fingers are in his ears, he can't hear me, which means he can't learn how to take care of his teeth. Well, I don't really care if Mr. Chimpanzee learns, but I want each and every one of you to listen to what I have to say, because from this point on, now we're going to start talking about how to take care of these beautiful teeth that we were given. As humans, we use our teeth for many things. Most importantly, we use them to chew our food. If you don't chew your food properly, you'll get an upset stomach. So that's the most important. The second thing we use them for is for speaking. Our teeth actually have to help us form words by how they hit our lips. And the third thing we use them for is to communicate through smiling. And everybody wants a pretty smile like this young lady in the picture. I think we can all agree that this is not the smile that most of us are shooting for. If you look at this gentleman, he's missing many teeth. Now, this was okay when you were a child and you lost your teeth, but this is the last set of teeth he was supposed to have. This will affect how he can chew his food, it affects his smile, and he wouldn't be able to say many words properly because he's missing so many teeth. So let's talk about what it takes to take care of these beautiful teeth we were given. The first thing we're going to talk about is how to properly brush your teeth. This is the single most important thing that I can teach you to do, and you should do it every day, at least twice a day, and spend a full 2 minutes when you're doing it. In order to brush your teeth properly, you need to start with the right tools. It's simple, really. The first thing you need is a brand new toothbrush. Take a look at this picture. This toothbrush is brand new out of the box, and all of the bristles are straight up and down. This allows it to do its job if you hold it properly along the gum line and brush back and forth. It'll remove the food that accumulated along your gums. Now let's look at our next toothbrush. Look at its bristles. They're all over the place. It looks like it's been beaten up, and in fact, some child has chewed on this toothbrush every night instead of actually using it for brushing. The bristles go left and right all over like a plate of spaghetti, and it can't possibly do a good job at cleaning their teeth. So even if they were spending 24 hours a day brushing with this, they're probably missing almost every area of their tooth. This one won't work. If your toothbrush looks like this when you get home, ask Mom and Dad for a new one. So now you know you need a good toothbrush to do the job. But what do we put on it? Does anybody out there remember what I told you? That's right, toothpaste. Now here's a picture of one brand, and I don't care what brand it is. I just care that you're putting some on and you're using the right amount, because a lot of children put on way too much, and if you eat too much toothpaste, if you swallow it when you're brushing, then you'll actually get an upset stomach. You don't need that much. Let's talk about how much toothpaste you should actually use. All the textbooks tell children to use a pea-sized amount of toothpaste. But I realized a few years ago that children weren't actually sure what that meant. So I found this picture, and this picture describes it perfectly. See that little green garden pea? Well, that is the perfect amount of toothpaste to put on your toothbrush. If you use just this small amount, then if you have to brush more times, you'll actually not be overdoing it with how much toothpaste you used. So this is the picture that all the companies use to advertise their toothpaste on TV. They always show a whole bunch, and it goes from the front to the back, and it makes that little tidal wave at the front. And while it makes for a cool picture, this is not what dentists recommend for how much children should use on their toothbrush. This is too much. This is about 4 times more than the pea-size amount I showed you just a minute ago. And if you have to brush more than once, as I'll show you in a few minutes, this would be way too much, and you could get an upset stomach. Alright, Ridge Road, here is your pop quiz. Take a look at this picture. Can anyone tell me if it's the left side or the right side that is the proper amount of toothpaste? Anyone? Yes, you in the back. You are correct. The left side is the proper amount of toothpaste. The one on the right is way too much. So now you know you need to have a nice toothbrush that can do a good job, and we talked about the right amount of toothpaste. This picture shows what that can do for you. See how the little bristles go up and down sort of like the tops of mountains? Well, that's where they're coming into contact with teeth. So if you have a good toothbrush and you're using it correctly along the gum line, it'll brush your teeth well, and it'll get all the food off so your gums can stay nice and healthy, and so you don't get any cavities. So let's talk about the next topic. We're going to talk about flossing. And as you can see my buddy's the lion here, flossing is when you use a string, or your friend's tail, to clean in between your teeth. And flossing, although it seems trivial, is actually in some cases more important than the brushing, and this is the step that most people skip, especially adults. So flossing comes as a string. That's all it is a string, a specially coated string that you can use to clean in between your teeth. You could brush 24 hours a day and still get cavities in between your teeth, because in between the teeth is where a lot of food hides. So, there is either this type, which comes in a little container, that is string you wrap around your fingers, or there's another version, such as these 2 examples, which is more like floss on a stick. I really don't care at your age which one you're using, as long as you're doing it every single day. My rule is, if you ate that day, you should floss that day. And most people skip it, but it comes back to get you. So this picture demonstrates a flossing technique. You wrap the thread around your fingers on each side, and then you go in between your teeth and up towards the gums, and then you actually have to curve it around the teeth to get any food out and to help keep the gums healthy. If you look in this picture,
The model's teeth are beautiful and the gums look very healthy. Unlike my next picture. Ouch, those gums look sore. So if you look on the floss, you can see little white, almost like snowballs, and that's food that was stuck in between this poor child's teeth. See how the gums are bleeding and look all red and swollen? That's sort of like if you got a sliver in your finger, how your finger gets all swollen and infected. The gums do the same thing, and if you don't get in there every day to floss and get the food out, your gums will be red, swollen, and infected, just like this poor child. It doesn't look comfortable, and I think that it's a good idea to floss. So now let's talk about some healthy choices. By healthy choices, I mean a good, healthy diet, not only for your teeth, but for your body. If you look at this picture, we're looking at fresh fruit. Fresh fruit like grapes and strawberries don't stick to your teeth when you eat them, which means they have less chance of causing cavities. They're also very healthy for your body, and they can help you grow big and strong. Another important food group is vegetables. While this picture doesn't look as yummy as the last one to many of you, vegetables are very good for your body. They provide a lot of vitamins and minerals that you need to grow strong. And also, there's nothing sticky in vegetables, so you can eat them and you don't have to worry about them hurting your teeth. And now let's talk about candy. Although this picture looks yummy to everybody in the audience, including Dr. Baker, I know that the things in this picture are sticky and sweet, and those are two things that'll cause cavities. So if you're going to eat candy, especially on holidays like Halloween, just make sure that you brush and floss and keep your teeth clean afterwards so that the candy doesn't sit on those teeth for too long and starts cavities forming. And remember, some candy is more sticky and worse for your teeth than others. This is a picture of Sour Patch Kids. The part that makes them sour is actually an acid. It has been measured to be almost as strong as battery acid, and that's something you don't want on your fingers, and you especially don't want it in your mouth and on your teeth. The stronger the acid, the more chance it's going to have of causing cavities and softening those teeth we're working so hard to keep. Just as there's healthy choices in the food world, there's also good and bad choices in what we drink. Water is a dentist's number one friend because there's nothing in it that could become a cavity. This is a picture of healthy orange juice. Naturally occurring drinks such as orange juice and fruit juices are good for your body and good for your teeth. Soda is not a healthy choice for children. There is no nutritional value in soda that children need to help grow big and strong. Soda typically has a lot of sugar in it to make it taste good, and all of that bubbly is what's called carbonic acid, and any acid, as I've talked about before, is not a healthy friend for your teeth. Soda comes in sugar and sugar-free brands, although don't let either one of them trick you. Even if it doesn't have sugar in it, that soda isn't good for you. In fact, all of the diet sodas that have 0 calories in them are actually more acidic than the ones with sugar in them. So be careful. And just like I told you earlier, the dentist's best friend is water. So you would think that any water is good for you to drink, right? Well, you have to be careful because all of these advertisers are tricky. Take this picture, for example, called Fruit 2O. It's water that tastes like different fruits. So you would think it's healthy, right? Well, they actually add acid to the water to make it taste like the different fruit groups. So, even though it is water, you have to be careful because sometimes it's just as acidic as the soda that I told you was very bad for your teeth. There's also many sports drinks on the market. And if you look at this picture, Gatorade is number one. Gatorade was developed for the Florida football team for the big college players to replenish all the nutrients that they lost playing football in the hot Florida sun. Gatorade works well for those big guys, but as far as children, Gatorade doesn't have anything that you need to grow. If you're playing sports, I recommend taking water with you because water is what your body needs. When you get older, you can consider Gatorade, but there's lots of sugars and salts in there that are not healthy for your teeth. So let's talk about going to the dentist. What does the dentist do? Well, in addition to cleaning your teeth and making sure that we get everything off that you missed, We also do things such as taking x-rays like we're doing on this little girl here. We take x-rays which are a picture, and the picture shows us the inside of your teeth and in between them so we can look for cavities. We also take x-rays called panoramics, which is what this little girl is getting. The panoramic x-ray wraps around your head and takes a picture of not only the teeth that you have in your mouth, but the teeth that you're supposed to be getting as you get to be an adult. However, some children don't get all of their teeth, and this x-ray helps us plan for the future in case you'll be missing some. X-rays are important for this reason right here. See this tooth? See that tiny little brown hole? You wouldn't think there's anything in there, would you? Well, this is a cavity underneath the surface of the tooth that's hiding at the bottom of those grooves. And in my next picture, it'll show you how something so small can actually be a big problem underneath that we can't see without an x-ray. So this is the exact same tooth as the last picture. That little brown spot opened up to a huge cavity underneath. And as the bigger the cavity gets, it actually gets painful and can cause problems for you. So as a dentist, we want to find cavities when they're small. Nobody wants a cavity, but if you have to have one, I can fix it when it's small, and it can help you keep your tooth for the rest of your life. This tooth here with such a big cavity can turn into a problem over time. And a lot of what a dentist does is called prevention. What that means is stop something before it happens. So I showed you the last picture with those deep grooves that turned into a cavity. Well, we can prevent that. If you look at this picture, the one on the left has all of these deep grooves in it, sort of like the cracks in a driveway. And what do you do to your driveway cracks? You seal them. So that's what a sealant does. If you look at the picture on the right, all of those grooves are missing. Well, we put a plastic coating in all of those grooves to help prevent food and bacteria from getting down in there and causing a cavity in the first place. What a genius idea!
So just remember, kids, brush, floss, and Ridge Road rocks.